Hello everyone and welcome to today's presentation, which is part of a series of webinars provided by the Division of Public Health, Section of Chronic Disease Prevention and Health Promotion. Our section's vision is for healthy and safe Alaskans. Sorry people, give me 1 second. Oh, sorry. And our mission is to identify and advance conditions that lead to safe and healthy lives. The primary aspects of our work include health promotion, chronic disease prevention, and data collection and surveillance. This webinar series was created to provide a forum where we, as public health professionals, can have an open dialogue around specific projects and explore ways to collaborate. We will be offering webinars on the third Tuesday of the month. In addition to sharing our work with you, we hope that these webinars will spark your interest in learning more about our projects and explore opportunities for further collaboration. To give you a sneak preview of a few upcoming webinars, in April we will be discussing Alaska's Heart Disease and Stroke Program, and in May we'll be presenting resources available that allow you to better understand the health status of Alaskans. Another way you can stay connected to our work is through our monthly newsletter. You can sign up for this on the section's website. Our website's address is at the bottom of all of our slides. There are a few housekeeping items to go over before we start. Please mute your phone. Also, please do not put this call on hold if you receive a call. Please hang up and call back in after you're done with your phone call. The webinar is planned for 30 minutes, a 20-minute presentation followed by 10 minutes of open dialogue. The audio for this webinar will come through your computer. Another option, if your computer isn't set up for the audio, is to call the number provided on the screen. If you have technical difficulties, please let us know by using the question function on the GoToWebinar control panel. You see the box here where you can enter your question in. You'll need a microphone on your computer, or you'll need to call in the number provided to ask a question out loud. Please hold your questions until the end of the presentation. To ask a question, please raise your hand by clicking the hand button in the GoToWebinar control panel. With that, I will let today's speaker and with that, I'll have today's speaker introduce herself and her subject.
I'm Kimberly Morgan, Primary Care and State Health Systems Manager with the American Cancer Society for the past 4.5 months. Our goal is to implement system practice and policy changes, evidence-based interventions, and promising practices aligned with the American Cancer Society priorities to advance prevention, early detection, and quality of life to include survivorship and palliative care. In 2016, we continue to engage partners in colorectal cancer work, focusing on reaching 80% screened by 2018, encouraging all Alaskans to protect their health by learning about the importance of early detection and seeking appropriate screening for colorectal cancer.
And good afternoon. I'm Julia Thorsness, and I'm with the State of Alaska Comprehensive Cancer Partnership. We work together through partnerships to address cancer for all Alaskans, and our vision is a cancer-free Alaska. March, as you hopefully well know, is Cancer Awareness Month, and we are pleased to offer this webinar today together in support of this important work. We hope by the end of this webinar you'll understand why colorectal cancer is an important issue for all Alaskans. You'll gain some knowledge of how colorectal cancer is preventable and some of the screening tools that are available. And finally, find out how you can join us in supporting this new national initiative, 80% by 2018, and helping us to move beyond awareness to action, and so increased screenings for all Alaskans. So what do we know? We know for sure that colorectal cancer is a huge issue for all Alaskans. It's the #2 cause of death in Alaska, while the #1 cause continues to be lung cancer. It's the #1 most commonly diagnosed cancer in Alaska Native people. And we also know that it's 90% curable if found early and polyps are removed. Colorectal cancer is also screenable and preventable, and it's found in both men and women. It is a huge myth that seems to be women think it's only in men, and men think it's only in women. So we hope that you will be able to help us in spreading the word that it happens in both men and women. So just quick word about screening guidelines. You need to get this screening when you turn 50 years old and at the age of 40 for Alaska Native people for average risk. And you should start at age 40 or even younger if you have a family member who has had colorectal cancer. So we'd like to talk a little bit about ways you can reduce your risk for colorectal cancer. This is a new infographic from American Institute for Cancer Research, and they estimate that about half of the new cases could be prevented by eating well, moving more, and staying lean. And what surprisingly is missing from this slide and their infographic is tobacco use. There have been many studies that link tobacco use with colorectal cancer and that increased risk. So you increase your risk with obesity, eating red and processed meats, for example, bacon, sausage, hot dogs, cold cuts, as well as smoking and high alcohol use. And you can decrease your risk by being physically active for at least 30 minutes, at least 5 days a week, maintaining a healthy weight, eating fruits, vegetables, especially broccoli, cauliflower, and those in the cabbage family, and of course, getting screened as appropriate. Yet even though we know colorectal cancer screening is important and it's preventable, many of us are not getting screened. Barriers exist for both insured and the uninsured. While cost is one barrier, the screening tool itself can be a barrier. And sometimes we scientifically refer to this as the yuck factor. People don't want to be talking about what they need to do to be screened for colorectal cancer. There was a recent study that was completed of people without insurance, and it's available on the National Colorectal Cancer Roundtable website. It showed that the insured shared that their number one fear was related to cost. Colonoscopies are expensive, and even when the screening is covered, there may be unexpected co-pays if it becomes a diagnostic test and a polyp is removed. Even those with Medicare coverage report co-pays of $300 or more. And of course, this calls for policy work, and our friends at American Cancer Society Cancer Action Network are currently working on that on a national level, as well as locally working to make sure that all people are covered for a screening colonoscopy, including retired state employees. So this same study also reported that the number one commonality for those without insurance who had not been screened was that they did not have their own personal experience with cancer. And this is why messages from champions and those that are survivors are so important to share their personal experience. We're lucky to have great leadership from the Alaska Native Tribal Health Consortium and a website called alaskacolonhealth.org. And it was created and features stories from a variety of Alaskans as to why they got screened and how colorectal cancer is a cancer I can prevent. So we are going to share a PSA that was done, and then one of the personal stories as well that is available on that website.
I didn't know what I was going into, so I was really super nervous.
Alaska Natives, we have a very high rate of colon cancer.
Screening, get it done early, can prevent a lot of heartache later.
It's just peace of mind, and most of the insurances cover the bulk of it.
It's a piece of cake.
And real men suck it up and go get them.
And when I turned 50, it was my turn. Colorectal cancer, the cancer I can prevent.
I work with colorectal cancer awareness and prevention, so it's really important for me. And let's take charge of our health together.
Health is always number one. Then they set you up with a date, in our case a double date.
I think we had the best provider ever, and he was so thrilled to be able to set up a room side by side. The provider actually rolled the bed right up to my bed, and it was a very comfortable process. People would walk by and, oh, you two are going in this together. It certainly gave me a peace of mind, and it especially gave me a peace of mind to know that my husband was healthy and cancer-free.
It's a piece of cake. Especially if you got your partner with you.
That's the best double date I've ever gone on with my husband.
The cancer I can prevent.
And I'd like to say a special thank you to Velda Miller for giving us permission to share her personal story with her husband about getting screened and being able to prevent colorectal cancer. So the folks that you see on this slide, each of them have shared their story, and it's available on the website, alaska-health.org. And it has a lot of different toolkits, materials, postcards, flyers, posters that you can print out and put up yourself at your work site, at your church, wherever you think it would be helpful to get the word out. And we really appreciate these people stepping up and being willing to be champions and speak out about their own story. And it's a great way to normalize the conversation around colorectal cancer screening and encourage others to get screened. So this is our next step. We are ready to join this 80% by 2018 national initiative. We know that currently only 62% of Alaskans have been screened for colorectal cancer. We also know that the tribal health system has made great strides and are really leading the way, and Alaska Native people have improved their screening to 66%. On average for all Alaskans, it's simply going up very slightly by about 2% each year. But we also know that the best screening is the one that actually gets done, so we can all have an impact by helping people know that there are choices in terms of how to get screened for colorectal cancer. So this is a screenshot of a tool from the CDC that helps make selection about what is the right test. The colonoscopy may not be the best test for everyone, and there are choices. These are all recommended by the U.S. PSTF, the United States Preventive Services Task Force, and that is what the state of Alaska looks to for making recommendations. And you can see a lot of detail in terms of why things work and why things may not be the best choice. For the FOBT and the FIT test, it's an annual test, and people sometimes forget that. It has to be done annually. And also there can be some food restrictions to make sure that you have a good result. If you have a positive result, you still have to get a colonoscopy, because that is the standard test where you can actually have the polyp or the growth removed. So those are some things to consider. The other time when you take a look at the colonoscopy, you need to remember that you have to do the prep, which there are many choices that your medical provider can help you make a decision for. You likely have to take a day off work. You need someone to accompany you, and a clear diet is required before the test. And the good news from my perspective is that once you've completed it, you don't need to do it for another 10 years if no polyps are found. So the decision has been made. So now I'm going to turn it over to Kimberly to talk some more about 80% by 2018.
So we are ready to join this national initiative. 80% by 2018 is a movement in which dozens of organizations have committed to eliminating colorectal cancer as a major public health problem and are working toward the shared goal of reaching 80% screening for colorectal cancer by 2018, moving from education and awareness to action. We need everyone's help to meet this goal. The American Cancer Society has already partnered with the AARP, the American Diabetes Association, the American Public Health Association, Walgreens, and more. But in order to reach our goal of screening 77,000 Alaskans by 2018, we need even more committed organizations to help promote, share, and build capacity in our state. In the toolkit will be resources for social media messengers. Because thanks to Pew Research Center, we know as of 2014, 74% of adults use social networking sites. About 20% use Twitter and 70% use Facebook. The CDC Social Media Works is a great website tool complete with sample templates to think through step by step and establish your social media strategy. George Washington Cancer Institute developed a comprehensive colorectal cancer awareness toolkit focused on social media. So this is how we can reach the unscreened with effective messages critical to that specific population, creating messages that motivate and help eliminate barriers to screening, promote screening in March and beyond. We even have a colorectal cancer marketing messages campaign specific to rural and remote areas. Dr. Richard Winder, the American Cancer Society's Chief Cancer Control Officer, has a blog highlighting successes, leaders, best practices, and tools making an impact in the nationwide movement towards 80% screen for colorectal cancer. Let's put Alaska on the map by offering a blog post about the work we are doing. So now it's time for a coordinated push. At the most basic level, an organization is committing to investing more energy in increasing colorectal cancer screening rates than they did before. Part of the 80% by 2018 goal is to leverage the energy of multiple and diverse committed partners to make history and achieve this remarkable public health goal. So by working together, demanding more of ourselves, and collectively pushing harder towards this common goal, we will make greater progress, prevent more cancers, and save more lives than we would by acting alone. We have tools and resources for FQHCs, primary care physicians, communities, insurers, employers, and hospitals, which shares information on how these entities can be engaged in increasing colorectal cancer screening rates. Ideas for promoting colorectal cancer awareness would be to consider adding a health moment type of announcement to your meeting agendas to raise awareness, print posters for elevator signs or cafe break room table tents, or use electronic versions to display on plasma screens. Sponsor a colorectal cancer drop-by booth, hold a skeptics town hall or lunch and learn to discuss screening options and share educational resources. You may even want to add a line to your email signature during Colorectal Cancer Awareness Month and beyond that says, proud supporter of 80% by 2018, committed to eliminating colorectal cancer as a major public health problem in Alaska. I have lots of great ideas on health communications and promotions to support the provided toolkits. So the call to action, how you can help. Get screened yourself and your family. Promote screening through your work site, website, social media page, co-branded reminder postcards and e-cards, and take the pledge. Today we hope you've learned about the reason colorectal cancer screening is an important issue for all Alaskans, how colorectal cancer is preventable and screenable, and about the 80% by 2018 initiative. Some of my final thoughts are, your body is the only suit you have for the rest of your life. Protect that lifelong investment through proper nutrition, to include cruciferous vegetables, fruits, and fiber. Exercise 150 minutes per week, and getting the recommended colorectal cancer screenings for your age bracket. Age 40 for Alaskan Natives or high-risk individuals, age 45 for African Americans, and age 50 is the standard for your first colonoscopy.
All right, I think that's the end of the actual presentation. Thank you very much, Julia and Kimberly. That was great. So now it's time to open the lines up for questions, comments, discussion. Remember, we're going to go down one more slide. I'm just going to put a reminder up there to hit your hand on your screen if you want to ask a question, and we'll unmute you. We're leaving everybody muted until you actually have a question. If you would rather type your question in, it's great to have one-on-one dialogue back and forth. But if you would rather type it in, go ahead and type it into the box for the questions, and we can answer those now. And I'm waiting for questions to come in. But in the meantime, just because this usually comes up, you will receive a link in a few days of a recording of this session, and it'll have not only the session itself, a videotape of that, but a PDF of all of the slides. So you'll have that as a resource for you. No questions yet? You guys must have been very thorough.
Should we talk about the resource?
You want to go up to the resource list?
Yeah, but just kind of talk through those ones.
Just 1 second, we're going to get back there.
Sure, so the first website is to the Alaska Colon Health, where you'll find those videos and the other toolkits. The second website is to the National Colorectal Cancer Roundtable.org. a plethora of information that can be used, very well cataloged and tabbed, very user-friendly. And then the last link is to the State Department of Health's newsletter focused on colorectal cancer.
Thank you. And again, this will be sent out. If you, in a couple of days when you get the link, everybody that has joined us today will receive an email with the link to this, so you can go back and find those resources in the PDF itself. I'm not seeing any questions right now. I'm going to give you guys a few more seconds. I'm not seeing any. You guys must have done a great job explaining everything. So with that, we'll conclude the webinar. Please join us again next month for our next webinar series, and have a great day.
Thank you.
Thank you.
Thank you, everyone.